Tonight, we are pleased to honor the achievements of 10 family physicians, one from each province, and present them with the 2016 Reg L Perkin Award.
Ces médecins de famille remarquables ont été reconnus par leurs collègues et par leur section provinciale pour leurs contributions exceptionnelles dans le domaine de la médecine familiale.
We are pleased to introduce the 2016 Family Physicians of the Year. Dr. Rodney Andrew, Vancouver, British Columbia. A true leader in his community, Dr. Andrew is lauded for his insightful influence in advancing family medicine. Dr. Andrew began his medical career as a captain in the British Royal Army Medical Corps.
Il s'est ensuite installé au Canada et a commencé à travailler à St. Paul's Hospital à Vancouver.
He led the development of an innovative horizontal competency-based curriculum. As director of the International Medical Graduate Program with the University of British Columbia, he championed the IMG Residency Training Program at St. Paul's Hospital, the first of its kind in North America, and has made a significant contribution to advancing provincial health policies. Dr. Paul Humphreys, Spruce Grove, Alberta. Dr. Humphreys is honored by his peers for his unwavering passion for patient care and commitment to medical education. For more than 30 years, he has practiced comprehensive family medicine with clinical interests in general practice, anesthesia, obstetrics, and palliative care.
S'impliquant activement dans la formation médicale, Dr. Humphreys est directeur des études médicales postdoctorales et co-directeur du programme de soutien éducatif de l'Université de l'Alberta.
Responsible for developing and managing residency teaching programs in both Ontario and Alberta, he is the founding director of the Northwestern Ontario Family Medicine Residency Program and a family partner of the Competency-Based Achievement System.
Dr. Antoinette Le Roux, Regina, Saskatchewan.
Dr. Le Roux is praised by her community for her outstanding commitment to patients.
Plus tôt cette année, Dr. Le Roux a mis fin à sa pratique active après 26 ans de service en médecine familiale. Elle se consacre désormais à son rôle de directrice médicale à temps complet pour la Cooperators, compagnie d'assurance vie.
Dr. Le Roux also supports medical education through her role as a clinical associate professor at the University of Saskatchewan and works as part of a multidisciplinary team for Workers' Compensation Board and Saskatchewan Government Insurance. Dr. Le Roux also devotes time to supporting an Erectian family whom she helped to immigrate to Canada and continues to support. Dr. Pravinsagar Mehta, Winnipeg, Manitoba. Since 1976, Dr. Mehta has practiced family medicine in the St. Boniface area of Winnipeg. In addition to his full-time practice, he provides primary care to elderly patients in personal care home facilities and regularly conducts house calls.
Membre du programme gériatrique à l'hôpital de Saint-Boniface depuis plus de 40 ans, il a joué un rôle de premier plan dans la création de programmes pour les aînés à l'hôpital Concordia ainsi que dans l'unité comportementale Béthania pour les personnes atteintes de troubles cognitifs.
Dr. Mehta currently serves as president of the Winnipeg Regional Health Authority Medical Staff Council and a member of the CFPC's Health Care of the Elderly Program Committee, and an assistant professor of family medicine at the University of Manitoba. Dr. Merrilee Brown, Port Perry, Ontario.
Dr. Brown fait preuve de solides compétences en tant que praticienne généraliste dans les régions rurales et aussi d'engagement face à l'enseignement et au mentorat envers les médecins pratiquants en milieu rural. Son champ d'activité est vaste et il comprend les soins périnatals, les soins d'urgence, les visites à domicile, les soins aux patients hospitalisés ainsi que les soins palliatifs.
Devoted to supporting rural medicine through education and practice, Dr. Brown has worked with the Society of Rural Physicians of Canada since 2006 and serves on the Rural Ontario Medical Program Foundation's Board of Directors. Throughout her career, she has been dedicated to making medical education responsive to community needs. She is currently an assistant professor at Queen's University and lecturer at the University of Toronto.
Dr. Marie Hayes, Sherbrooke, Québec. Dr. Hayes a commencé sa carrière en tant que médecin de famille en milieu rural dans la région de Pontiac, au Québec. Au cours des 20 dernières années, elle a pratiqué la médecine d'urgence, l'obstétrique et les soins de longue durée à Sherbrooke, Québec, tout en gérant sa propre clinique. Cofondatrice et copropriétaire de la clinique de santé Jacques-Cartier, elle est directrice médicale pour le GMF Jacques-Cartier, qui comprend une équipe interdisciplinaire de plus de 20 professionnels de la santé.
Dr. Hayes has a particular interest in integrated physical and mental health care. Currently, she is a clinical professor at the University of Sherbrooke and is responsible for the mental health teaching program at the Jacques Cartier Family Medicine Teaching Unit.
Dr. Samuel Daigle, Bathurst, Nouveau-Brunswick.
Dr. Daigle is recognized for his unique passion for the outdoors and for integrating physical activity into the prevention and treatment of disease.
Pendant plus de 16 ans, il a pratiqué la médecine familiale à Bathurst et il a occupé plusieurs postes, dont celui du chef du service d'obstétrique, chef d'urgence et chef du comité d'examen des titres à l'hôpital régional Chaleur. En tant qu'un membre actif des réseaux communautaires dans la région Chaleur, il a lancé de nombreux projets de rénovation axés sur la santé. Il tente de persuader ses collègues d'adopter une différente approche envers la médecine familiale en les encourageant à prescrire de l'activité physique.
Dr. Daigle leads by example, by using his carpentry talents to build structures such as safe hiking trails to encourage patients to adopt an active lifestyle. Dr. David Martel, Lunenburg, Nova Scotia. Dr. Martel has practiced family medicine in Lunenburg for more than a decade and currently works with the Lunenburg Family Health Team, a collaborative, multidisciplinary primary care clinic.
Sa première clinique, le Centre médical à Lunenburg, a été une chef de file parmi les centres de soins primaires en Nouvelle-Écosse, comme on avait mis à l'essai l'utilisation du logiciel destiné à fournir des dossiers médicaux électroniques.
With special interest in addiction medicine, Dr. Martel has played an instrumental role with the South Shore opioid community, an interprofessional initiative dedicated to helping patients with opioid addictions. As an advocate for individuals who are often marginalized by society, he has demonstrated outstanding commitment in guiding these patients through various recovery programs. Dr. Garth Slysz, Charlottetown, Prince Edward Island. Dr. Slysz is honored for his compassion and leadership in international humanitarian aid. Dr. Slysz practices at the Sherwood Family Medical Center in Charlottetown, where he also mentors medical students and family medicine residents. Since 2011, he has organized and led several missions to Haiti to help people who would otherwise not have access to medical care. He has also been instrumental in procuring a regular supply of medications for Haitian clinics.
En plus d'exercer sa pratique en médecine familiale en clinique, Dr. Slysz est professeur adjoint et superviseur à l'Université d'Alousie et directeur de la formation continue à l'hôpital Queen Elizabeth.
Dr. Pauline Duke, St. John's, Newfoundland and Labrador. A prominent family physician in Newfoundland, Dr. Duke is admired for providing patient-centered care, working with local refugees, and teaching new generations of family doctors.
Depuis 1989, Dr. Duke pratique la médecine familiale à St. John's. Elle offre des soins cliniques complets et globaux, des visites à domicile, des soins palliatifs à domicile, des soins gériatriques ainsi que des soins prénataux et axés sur la santé des femmes.
She provides healthcare services for refugees through the Family Practice Unit at Memorial University's Faculty of Medicine. Her dedication also extends into her work with Memorial University of Newfoundland's Med Gateway Project, an initiative through which students take histories and provide physical exam screenings for new refugees. It has been a pleasure to present this year's Reg L Perkin Award recipients.
Joignez-vous à moi pour féliciter les médecins de famille du Canada de l'année 2016.
Please join us in congratulating Canada's Family Physicians of the Year for 2016.